Assalamu alaikum, everyone. My name is Waleed, co-founder of NexHealth. It's been about 9 years I've been building NexHealth. I dropped out of college. I was doing computer science at City College of New York. It's been a long journey, actually. So I dropped out when I had about one semester, about 1.5 semester left. A lot of family, friends are all like, you're wasting your life. What are you doing? Don't drop out. But I ended up doing it anyway because the problem that we sort of came across in healthcare, my co-founder, he was doing biomed and he was working at a doctor's office. That's how we came across the problem that we're solving today. And once he sort of ramped me up on some of the problems that he saw in healthcare, some of the problems that we all see, that we've been to the doctor's office, we've seen, everything's paper-based, everything is sort of in the Stone Age, right? You have to sort of, if you want access to your own medical records, you have to, call the doctor, go to the office, sign some papers, come back a week later, they give you a CD-ROM or they fax it over to you, right? It's a whole mess, right? And it's still like that in many places. Some places are digitizing it, but it's still a very slow process, right? And there's, everything's phone-based, everything's paper-based. So we sort of saw the problems in healthcare, and it convinced me to sort of drop out from college. That's how big the problems were that we saw, right? So in a nutshell, the problem that NexHealth solves is we tell doctors, give us your healthcare data and we let you do things with it, right? Things that you can't do with it previously. So the problem in healthcare today is all data is locked away in these systems called electronic health record softwares, which is sort of like patient data entry systems. Like there's scheduling data in there, there's x-ray data in there, appointments, medication history, allergy history, insurance information, payments information, all that data sort of, it's a very complex software. All your healthcare data is in that software, right? So it's like actually 8 different softwares built into one clunky software. And a lot of this archaic software too, that was built in the 80s and the 90s. So what we did was we sort of, as we ramped up on some of the problems, all this data is in the system and doctors were like, hey, this is a core part of our workflow. It's actually mandated by the government to use this software, right? But once you put data in there, you can't really get data out of it. If you want to run automation in your business, if you want to do analysis on your business, you can't really do that with the software, even though there's so much data, valuable data in this software, right? And then on top of that, some of the problems that happen are when there's a pharmacy company or a hospital or someone doing research, clinical trials, for example, right? And they want to identify good candidates for a clinical trial. They can't really do that without getting access to this data, right? And the way typically you get access to this data is you have to go through the vendor of the electronic health record software. You have to, ask permission first, and then number 2, pay a premium for that data. So, they give you like maybe 5,000 patients, and they charge you $50,000 to get that data, right? So they have a monopoly on this data. And the other problem on top of that is it's very fragmented, right? There's 1,000 plus electronic health record softwares out there, right? There's like maybe 20 for cardiology, 20 for optometry, 15 for dentistry, right? It's a very fragmented place. So there's no one player, no one vendor that has market share, right? It's very like, 5% market share, 10% market share max you would find, right? So this is the problem that we came across, and this is the reason why healthcare is sort of lagging behind every other industry, is because your data is locked up. You can't do stuff with that data, right? So that's where we sort of came in and we said, hey, what can we do with this data? And early on, we started, talking to customers, asking them what are their pain points, and doctors and customers have sort of mentioned, hey, I want this feature, I want this feature, I want this feature. They sort of like tell you what to build, but if you read between the lines, all the problems sort of stem from we don't have access to this data, so we can't do cool stuff with it, right? So that's where we sort of built this product. We call it the patient experience product. We sort of manage the end-to-end patient experience from online booking, from capturing a patient before they're even in the office, right, to, once they book an appointment, doing the follow-up to make sure that they come to the appointment, right? Sending them reminders, sending them automated text messages, emails, etc. Doing the pre-work, the paperwork, the digital paperwork that needs to be done before they come into the office, right? After they come into the visit, doing follow-ups, messaging, for their appointment. Maybe there's some medication that they need to take, some procedures that they need to do, sending them surveys on how their visit was, and then also getting them to come back to their next appointments. Maybe it's a follow-up in 2 weeks, maybe it's a follow-up in 6 months. We sort of manage the end-to-end patient experience there. So we built that product, and that's what we're selling today. We call it the patient experience product. So our main customer is the doctor or the owner of the doctor's office. Your small mom and pop shops, your cardiologist down the street. That's our main customer that we sell to today. They pay us monthly, about $400 or $500 a month per doctor. So that's one product that we have. We have another product that we sort of offer, which is an API on top of this data, right, to get access to this data for healthcare developers. So, for example, PAM AI, right? I think you reached out to me a few months back, and you wanted access to certain type of data to be able to run your call center. You have a sort of AI bot for call centers, or after-hour calls that come to doctors' offices, right? Like a receptionist, virtual receptionist. So companies like this, we sort of offer an API to be able to interact with this EHR data, electronic health record data, right? So let's say PAM AI comes and some patient calls an office that uses PAM AI after hours, the bot picks up, right? I think the bot will maybe schedule an appointment on behalf of the patient or things like that. Yeah. So using our API, they could sort of add that appointment inside the electronic health record software, read and write data back into it automatically without having to have a human in the loop, right? So that's like the second thing that we offer. And then longer term, we want to sort of have like a platform for patients where you can sort of own your medical data, right? You have access to all your medical records. Maybe you move from, like I moved from New York to San Francisco 5 years ago. All the doctors that I saw back in New York, all that data is locked up with them. I don't have access to that data. Doctors that I go to over here, I have to explain to them my entire health history, right? They have no context as to who I am as a patient. So longer term, we're going to compete with Apple. Apple has a health app. If you guys ever played around with it, if you've ever been to a hospital that participates with Apple, you can actually get all your lab data, your medication, your immunization records, all that stuff on the Apple Health app, right? So Apple works with hospitals. We work with like your local mom and pop shop. So at some point, we're probably going to compete with them. But we want to become like the health app on your phone, basically, longer term. So that all your health data is there. If you go to a new doctor, you don't have to fill out 10 pieces of paper all over again. The same data you sort of input every single time, right? You sort of just use the same exact form that you've already submitted to other doctors. You could just submit that again, right? So that's like a high-level overview of what NexHealth does. We have like 3 main initiatives. We call it like the 3-step master plan to conquer healthcare. But yeah, I think the topic today is product market fit, how to find it. I think most companies here are probably seed stage, pre-seed, right? Am I right? Anyone past the seed stage here? Okay, cool. Yeah, that makes sense. So I guess I could talk about a few things. I took some notes. And I took these notes this morning, so apologize if it's a mess. And feel free to ask questions along the way and interrupt me. I don't. That's perfectly fine. So I think what I've learned in this journey. So to give you more context, we're at Series C was our last round 2 years ago. We raised about 160 million in total so far, alhamdulillah. And we have about 15,000 paying customers and about 260 employees, just to give you some context like where we're at today, right? And this is all in the last like 3 years where we got to sort of the scale. Before that, it was, it was a different story. It was like, 4 or 5 years ago, it was just 15 people in a room, just trying to manage the entire, manage like 2,000 customers with 15 people, right? It was a huge mess, right? And a lot of that was caused by us sort of not understanding when did we hit product market fit. So I'm going to talk about that story a little bit. So the process of finding product market fit, I think the first one is the definition stage. I think all of you guys are sort of in that definition stage. You're still trying to define the product, right? It's not concretely defined yet. And I think that in itself is one of the hardest parts, right? And there's lots of parts to it. There's what does your sales pitch look like, right? How do you sort of dig into customer problems when you're talking to customers on a sales call, right? Is your co-founder aligned with what you're building, right? There's sort of all these different factors that go into it. It's not just like one or two things. It's not just like the features that you build. It's about, are you actually building something that solves a problem and people will pay you a lot of money for it, right? And I think this is where a lot of people get, founders typically like to believe that they have the best product, and which is good, right? You have to have strong conviction in what you're building. But if the market isn't reacting, you have to sort of give yourself a reality check, right? And I think this is where most founders, this is where we messed up, right? We messed up for 2 years, I think, just sort of building, and not sort of seeing, okay, is this the right thing to build, right? About a year and a half we spent sort of just building something, and and not getting paid for it, and then we didn't get signal fast enough, right? So I think I'll talk more about that later, but I guess I'll talk about the definition stage, right? Really figuring out in this defining stage of product market fit, right? I think one thing I want to call out is the sales call is super important. Like when you're talking to a prospective customer, being consultative in how you talk to them, right? Asking them what are the problems that they deal with, right? You know, digging into what are their workflows right now, right? Digging into getting a full end-to-end understanding of how they deal with their customers, what are their pain points, right? There's a book called The Challenger Sale. Has anyone ever read The Challenger Sale? Nobody? I think that's like, you guys have to read that. If you're selling the product, you have to read that book, right? There's 5 main ways that people sell. There's like relationship based, right? There's people that, you know, try to build relationships with whoever they're selling to. But the best one is the consultative approach, where you're sort of digging into the problem and solving the problem for the customer, right? Not just sort of selling and pitching what you sort of built and like feature selling and things like that, right? And so I think that's where we sort of did a lot of that early on. And I think the consultative approach is basically, you know, you sort of dig into a customer's problem, you talk to them, you even meet them in person, right? You sort of go to them, and they'll tell you a bunch of features to go build, but you sort of have to read between the lines and see, okay, this is sort of the thing that they actually need, right? They're not telling me this, but this is what I sort of know. They're thinking from first principles, thinking from, okay, this is actually a real problem. This is actually this is a must-have. This is not just a nice-to-have, right? And I think a lot of people get caught up in building a nice-to-have and not a must-have, right? Building something that's transformative for a user, building something that's changing their life, right? And I think early on with NexHealth, we found that we were building a product that actually changed customers' lives, right? The office staff, you know, the amount of time we saved them, the amount of headache, the amount of paperwork that we saved them, it was actually life transforming, right? They were saving 2-3 hours per day. They were able to do things that they were never able to do before, right? And I'll talk more about that later as well. But I think in the sales pitch, that's like a key part of like actually figuring out what is your product, right? What should your product be, right? And I think following on from this is everyone should be selling ahead of the product, right? This is something that we learned the hard way. A lot of people, I think we also thought that we had to have the product built before you go sell it, but that's actually not true. You could sort of do a white lie and say, oh, we already have this built, and just sell ahead of the product. Be like, hey, okay, this is a problem that we identified on the call. We're gonna go build this. It makes sense to go build it, right? And I would hate this, right? I'm the CTO part. I'm the technical guy, right? So my founder was like, okay, I just closed this customer. You know, they're gonna pay us $10,000 a month, and I'm like, now I got to go build X, Y, Z, right? Why can't we just go, you know, focus on one thing? But I think that was key to understand, like, okay, the thing that we were building before this wasn't actually going to close deals, right? It wasn't going to move the needle, right? Really understanding that you have to be flexible early on to like react to customers' sentiment early on, right? And build features quickly. So always sell ahead of the product, yep. Yeah, I still struggle to this day, actually. So in Islam, you're sort of taught like you can't lie, especially when selling. I really had to like change my thinking on that. And I don't know, even to this day, I don't know if it's still against Islamic principles or not, but I do think you have to, like, in the startup stage, you have to sort of, time is everything. I think as long as you set expectation with customers that you're going to, that you will have this, right? And you do actually go build it, then it's a different story. Not like you're lying, straight up lying, like you're going to, you sell a feature and then you're just never going to build it. I think that's a different story. For us, it was always like, okay, yeah, we'll give you this we'll support this feature for you. We'll support this problem for you. We'll solve this problem for you. But it would take us like 2 months to go build it, right? But then I think we just set expectations like, okay, we have X amount of customers backed up. You know, we're still working on it. We're trying to get it working. We never actually ended up selling something that we ended up never supporting. We always ended up supporting it at some point. So customers can tell when you're smart and like you're really digging into their problems. And you're not just like selling and pitching and just like regurgitating some sales pitch, right? If customers can see that in your sales pitch, I think they'll trust you more, especially if you point out problems to them. Maybe a lot of times we actually pointed out problems to them that they didn't realize, right? We told, doctors, so our industry is full of doctors. Doctors are, they're the king of their own castle. That's what we say internally. They think they're super smart. They think they're like the smartest people in the world. They make a lot of money, right? So they have this sort of attitude that, like, I'm the smartest person in the room, right? Uh, but then so many times in sales pitches, we would like point out to them, you're doing this wrong, you're doing that wrong, right? And then they would be shocked, right? They'd be like, how can this person say that? And then some would get defensive. Some would actually be like, wow, this guy's, I should listen to this guy, right? So I think going back to what I was talking about the sales pitch, if you find problems for the customer that they weren't even thinking about, that's actually like one of the key things to get them to trust you. I think that helped us specifically early on. Yeah. Yeah. So going back to selling ahead of the product. So I think you shouldn't lie, but you should sell ahead of the product, right? And that's actually the best way to get signal early on. I think time is everything for startups. We don't have money. We don't have time. So you're not going to build everything that you sell. First, get signal from selling it. See if you can get customers to commit, pay up front, and then go build it, right? That's actually a better strategy for yourself and for the customer as well, right? Otherwise, you waste a lot of time going back and forth trying to build something. It's not going to work out, right? It's just a lot more cycles. You're just going to waste time and run out of money, right? Yeah, actually, so one example of that at NexHealth was, so we realized early on that NexHealth resonated a lot with what we call like a decision maker, right? So when you're talking to someone, you're talking to a customer, this person is your primary buyer. They maybe own the practice, maybe they own a key part of like the doctor's office, and they're making all the decisions in the doctor's office. It was easy for us to convince to them that, hey, this is how you can make more money, right? Our product gets you more appointments on the calendar, is going to make you more money through a better patient experience. But oftentimes, what we call detractors were the office staff managers, right? Like your typical office staff manager is sort of what we call like a, maybe they're 50 years old, 60 years old. They're sort of just like, they're working just part time. They're working just to support, support the family. They're not the main breadwinner in their home. They're just like supporting their family here and there. So their motivations are different than the doctors. They just want a simple life. They want an easy life, right? They don't want to do extra work. They don't like change, right? So what we oftentimes found was selling the product worked a lot, resonated a lot with decision makers, but then decision makers would not want to move forward once they talk to their staff members, and the staff members like, what is this new product? I don't want to work with this thing, right? And they're like adamant that we're not going to be okay with this, right? Just very resistant to change. So we tried that for a little bit, and it ended up being a big blocker for us. And we decided, you know what? Let's actually just go build something that will please these office managers, right? Something small and simple. And what we ended up building was a messaging tool. So our core, the very first feature we built was appointment scheduling, online scheduling for patients. So the way it worked is you put a widget on the website, and patients can go and book that appointment. If they Google doctor near me, they'll find the Google profile, they'll find the website, and you can book either through the Google profile or through the website. And it matches the branding of the website, and it matches the branding that the doctor wants. And it was a super simple workflow that actually was new to the industry. There was a competitor, ZocDoc, but it was a different tool, different problem. I'll talk more about that later. So this appointment online scheduling tool resonated a lot with doctors and decision makers, but then office managers were like, this is not going to work for us. So we ended up building a messaging tool for office managers to, instead of call patients one by one, they could message people on text instead, right? And this was a game changer for a lot of people. And we were actually one of the first people to build this feature in the healthcare industry. And one of the reasons why, side note, one of the reasons why we were the first people to build it is because a lot of regulations around HIPAA, people sort of just stayed away from this space and like didn't want to get involved with it. But we ended up going forward with it anyway, right? Technically, it is not a HIPAA compliant solution, but you can sort of bend the law to make it work, right? So that's one thing that we ended up doing. And this actually sort of satisfied both the decision maker and the non-decision maker, what we call, right? And I think this is actually sort of past. Go ahead.
Sorry, I want to make sure I understand. This is like so relevant.
Mm.
Basically, they used to be in the scheduling workflow. They used to own the scheduling workflow.
Yeah.
Now there's something else, and they removed from it, and actually it's kind of a black box to them.
Yeah.
Then in order to bridge that gap, you had messaging tools. They could see that stuff. They see who the person's profile is.
Yep.
And they're able to then like message that person. And
Yep.
that's actually a key part of their workflow.
Exactly. Yeah. So the appointment scheduling tool was going to be sort of adding. So office managers control the calendar for the doctor, and they didn't want the control to be outside of their control. They didn't want something else to have control outside of that, right? That was like the main objection. So to ease that objection, we said, here's a tool that will save you all this time, and you'll have 2 hours extra per day, right? And they loved it, right? And that's actually how we got past like that objection handling in sales calls, right? So that's one thing when it comes to product market fit. You have to sort of be aware of who is your buyer, but also who has input to buying as well, right? And I think this comes with part of like finding product market fit. I think this is all part of that. So that's one thing when it comes to selling ahead of the product. We started selling the messaging tool before we actually built it, and it ended up working. One thing early on when we were trying to find product market fit was a lot of objections came from doctors like, okay, there's a tool called ZocDoc. Anyway, are you guys familiar with ZocDoc? Anyone use ZocDoc before? Okay. So yeah, your dad works at ZocDoc. So ZocDoc, they're like a lead gen tool for doctors. They're a way for patients. It's like a Yelp for doctors. You can find doctors on it, and doctors can get patients through ZocDoc. But ZocDoc doesn't do anything after that, right? They don't manage the entire end-to-end patient experience. They don't. I'll give an example actually how we sort of differentiated with ZocDoc. Doctors would keep on asking, how do you differentiate with ZocDoc? Your tool's the same thing. It's online scheduling, right? So this is where the consultative approach in sales pitches actually comes in. What we would say is, I'll give you an example. There was one doctor, they owned about 15 or 20 offices in Michigan, Redwood Dental, and he was like not signing the deal, right? We were trying to sign a deal. It was going to be like $20,000 a month. It was going to save the business, actually. We were going to run out of money if we didn't save this deal, right? So we were trying to find a way to make this work. And, the doctor's sort of saying, ZocDoc does everything I needed to do. So what we ended up doing was going back to what what I was telling you about pointing out problems to customers on the call. We pointed out to them, hey, how does ZocDoc work today, right? A patient goes on a website. They go on your website, is your branding, is everything's all about you. But then your website redirects them to another website that potentially might let the patient go elsewhere, right? So you might be missing out on patients that you would be getting if you didn't allow them to go to ZocDoc, right? ZocDoc doesn't care about driving business to you. They just care about driving business to anyone on their platform, right? So when we pointed this out to the doctor was, very surprised that he never realized this, right? And then he realized he's missing out on a lot of patients. So we started using this as a differentiating sort of objection handling when people would say, hey, this is ZocDoc can do what you guys do. We started saying, yeah, but ZocDoc doesn't really care about owning your patient experience, making your patient experience very unique to you. ZocDoc has its own branding, sort of like a yellow color on their website. It's very ugly. You can go on that website and book anywhere. There's no incentive to actually keep that doctor to go only to you. So that's how we sort of differentiate. There's a lot of other things too, but that's one example of differentiating with the customers. And I think a lot of people, like with Rafa, for example, or like WorkSense, some of the things that I've heard, there are tools out there that sort of do what you guys do. You sort of have to find a way to like really differentiate and like point out problems to customers that they don't even realize, right? And I'm curious to hear from you guys later, like how you guys are doing that. So yeah, I think I'll go on to mistakes that I made early on. So we prematurely built out a sales team and a marketing team. We had about, actually not even marketing, salespeople. We had hired about 10 people from ZocDoc. They're all salespeople. And this is 2017. This is still actually when we first started building the product, but the product didn't actually work as advertised. So we raised in 2017, our seed, you could call it. And then we had a product that was sort of working, but it didn't work with like all the bells and whistles. Like I mentioned, like the messaging tool, for example, the online scheduling worked, but it didn't work in the sense that it didn't actually translate all the way into the electronic health record software. So for about 8 months, we were selling a product that didn't actually fully work. And we tried scaling it with those 10 salespeople before it actually fully worked, right? Before we actually validated that it actually worked, right? So we had 50 customers signed up, or 100 customers signed up, and 50 ended up canceling within 3 or 4 months because we couldn't onboard them because the product didn't work, right? So when it comes to finding product market fit, we couldn't find it. We couldn't validate that we actually found it because we couldn't onboard the customers because the product didn't work, right? And we had 10 salespeople selling it, and that's actually one of the mistakes that we made, right? So we ended up letting some of the salespeople go. Some of the salespeople just ended up leaving on their own, and we ended up just being a 4-person company for about a year and a half, from 2018 to 2019. Go ahead. Yeah, they're all paid. Yeah. So one thing I actually want to recommend on this side note is you should never give away your product for free, right? So currently, Arshan, you're giving me your product for free. You're giving me your product for free. You shouldn't do that, and I'll go into more of that later. But these were all paying customers. 100 paying customers. They were paying us about. We were probably making $40,000 a month on these customers, right? But they were not using the product because it didn't work, and they were like begging us for it to work. They were calling us every single day, right? They're so in a sense we did have product market fit. We just couldn't prove it out because no one actually went fully live with it, right? It didn't work as expected. So for about 6 months, mid 2017 to early 2018, we ended up, 50 customers canceled on us. We ended up going down. We lost a bunch of people. It was just 4 people. We ended up making the product work as it was intended to work. And then 2018 is when we sort of saw what I would call like the product market fit stage. Like we did find product market fit, but we didn't realize it, right? And there were some signals that I'll talk about, like some qualitative signals, some quantitative signals. But actually, before I get into that, there's actually other problems that we did, right? One was that we scaled the go-to-market team prematurely. That was one problem. The second problem was we launched 2 other major initiatives while just trying to launch the patient experience product. We launched a marketplace for doctors, and we launched a patient experience, like a patient-facing app, like an iOS and Android app, right? It was just too much for us to execute on, right? One was like a B2B motion, and 2 were B2C motions, right? Going direct to consumer. And we just didn't have the team for it. It was just too much, lack of focus, I would say, and lack of prioritization, right? So that was the second mistake that we made. Wasted a lot of money there, wasted a lot of time there as well, a lot of headaches. And I think the third mistake we made early on was not having internal alignment on what are the priorities and what is the product, right? As we were sort of defining the product, making sure that everyone was aligned on this is the product that we're now selling. This is now the way to pitch this product, right? Because we didn't have that internal alignment, people were just building whatever they wanted to build. People were just all over the place. People were selling whatever they wanted to sell, right? Being very prescriptive to your team about like, this is what we are now. Like things are going to keep on evolving. This is what we are now. This is what we need to go do. This is the priorities, and making sure that people aren't building like fluff, right? We were in 2017. I was building a lot of fluff, and actually, it was actually a lot of my fault too. Like I was actually owning part of the product and just building things on my own too. And that was actually a huge mistake. I should have just been focusing on one thing, doing it really well, make sure the product worked for the customers, and then going from there, right?
So my question was like, how did you actually think through the product and then get to like, I'm sure there was features on there. Like, how were you teaching your customers about the product and like about the features?
Like after they bought the product, or
yeah, like when you were like, oh, we were like building things on our own, and then we just like buckled down. And we're like, oh, we need to build these things out.
Yeah. So what we would do is basically, actually one of the mistakes we made was we started training people on the product before we nailed on the definition of the product, before the founders nailed on the definition, and that's where some of the internal misalignment came from. Like we were just selling the product wrong. We were training on the product incorrectly. We were onboarding customers incorrectly. I think one thing that we should have done earlier is me, my co-founder, and some of the early employees should have been just like the 3 of us doing onboarding, support, training, all that stuff on our own. I think that would have solved a lot of problems for us as well, and just drove to internal alignment. We offloaded that way too early, right? There was some random people that came from ZocDoc, for example, and they were sort of onboarding and training customers the way ZocDoc did it, and that was not the way we wanted it, right? But we didn't realize that until later on, right, in 2017. So I think one thing would be to like onboard customers yourself, the end-to-end experience. Just make sure you train them yourselves, you onboard them yourselves, you check in with them, do support for at least like the first year or 2, and just even after product market fit stage, like once you start scaling, keep doing that as much as possible, as much as you can, right? Even till this day, like I still do support, for example, right? I still do training if I like on a refreshing basis just to make sure I understand the product, right? Yeah. Does that answer your question? Yeah. Okay. So that, yeah, in the defining stage, yeah, that's sort of the points I had for defining stage. I think moving on to like knowing when we had product market fit, I think that was more of like, we actually didn't realize we had product market fit for at least a year and a half until like someone pointed out to us, like, you guys have product market fit. What are you guys doing? Why are you still a 4-person company, right? We had like maybe 1,000 or 1,500 customers and we were still 5 people, right? And it took an investor to like tell us that you guys are way past product market fit. You guys are just building features for the sake of building features at this point. You need to go to market now, right? And that's where we sort of realized, we took a step back and we saw, okay, yeah, actually you're right. And these are the signs that we sort of knew that we are at product market fit. So I think one of them was what I pointed out earlier. Users were buying the product before it was even ready. That was one sign of it, but we didn't get the validation up until later. We didn't have all the features that they wanted. We didn't have all the features that they demanded. But as long as we solved a core problem for them, which in the beginning was get them more appointments on the schedule, get them more money, they're willing to pay for that even when we didn't have it fully ready, right? Once we sort of started going live with a lot more customers, the second thing is, users couldn't live without the product, right? And we actually realized that users couldn't live without our product accidentally. So we had an incident where our site was down for about 4 hours. And it started at like 7 a.m. and it lasted till like about 1 p.m. or 12 p.m. And this is in 2018 or 2019, I don't remember. But we had maybe like 200 customers calling in asking like, every 5 minutes, is the site back up? When is it going to come back up, right? And then we're like, wow, we didn't expect this to actually happen, right? And that's when we realized that customers actually log into our product at 7 a.m. It's the first thing that they log into to check how many appointments were booked, how many messages came in, how many payments came in, how all these different things that sort of they manage in the office. We became critical to their workflow, right? And we found this out accidentally. We sort of knew we were solving a problem for them, but we didn't realize how big of a problem. We didn't know how important our product was to them until we sort of saw these qualitative signals like this, right? You go ahead.
Metrics that were like those aha metrics that allowed you to reconfirm your hypotheses.
Yeah. On the quantitative side, I would say, like, yeah, your numbers look healthy. Like, for example, over a period of time, your retention rates are super strong. Like at some point between 2018 and 2020, we had 0.5% month-over-month churn, meaning like barely any of our customers were actually canceling. That was one thing. Our net retention rates were super high. Month-over-month growth, year-over-year growth were like 100%, 200%, right? So those like quantitative metrics that you could look at, right? Like those churn metrics, things like that. How many people are actually paying for the product and how many are upselling, for example? Are customers continuing to, add more dollars on their account over time, right? That was actually a key one as well. So some of the metrics that we looked at were like churn, right? How many people were canceling per month? But others were like retention rates, net retention. So are customers adding more dollars per month? Are they upselling to maybe adding more locations or more doctors to their platform, to our platform, right? Are they adding more features? Are they buying more features, right? So all this was sort of going up and up for us, right? Versus the obvious metrics are if customers are canceling within 2 months or 3 months, right? Or they're always complaining to you about like features, and then like they're like, "Hey, we're gonna cancel if you don't have this," right? Those are like the more quantitative stuff. But on the qualitative side, going back to qualitative, so one was like users can't live without the product, and if you tell them that you're going to take away the product, like they will complain loudly. It's the first thing that they use in the morning. It's the first thing they use it every single day, right? It's transforming their lives daily. And some example for us was so going back to like another incident that actually happened was this still happens till this day, where I talked about we have like a bidirectional sync between the electronic health record software and our platform for like appointments. Let's say like a patient books online, we book it automatically inside the electronic health record software. We're also able to read that back into our platform on a live basis. If that process doesn't work, and sometimes it breaks, it doesn't work, we still to this day get, a bunch of calls and customers wanting to cancel if it doesn't work, right? And just recently we had a customer ask for a $70,000 credit just because it wasn't working for a few days, right? And that actually ended up making us question like, oh wow, this actually is that valuable to customers? Like we could actually charge more for this thing, right? So you have to look at these signals to see like how important is your product to the business, right? How important is your product to the user? Go ahead.
So how long did it take for users to get hooked on the product? Like what was the life cycle of that?
Yeah, I think for us we had a very white glove onboarding process for customers. We would make sure that they use the product fully within 90 days early on. So in 2017, 2018, especially 2018, like I was onboarding customers myself too. We would ensure that they adopted all the features in that onboarding phase. We call it like the 30-day, 60-day onboarding phase. And then we would check in with them throughout the period as well. I think if it wasn't for that, customers wouldn't be using our product nearly as much. So it was like that handheld white glove experience that we gave them early on to like ensure that they just force them to use the product, right? If we didn't do that, it wouldn't happen, right? And I think a lot of us here, like you should be onboarding customers by hand, by yourself, making sure like use the damn product basically, right? Go ahead.
Yeah, so as now, like, you mentioned how an early stage was like the marketing sales team was like putting a lot into that. But now as you're growing and expanding and probably obviously have more money, how do you kind of like be meticulous in how you spend that and not like overspend and like have like random costs? Or do you like kind of spend and review? Like what do you?
Yeah, that's a whole separate conversation. we're dealing with that right now. I think at most of your stages, you're not going to be dealing with that right now. You should be super cost conscious. You shouldn't be wasting money. Once you raise money, just like be super disciplined, right? Yeah, like don't let it be a free for all. Once you raise money, where like people are just spending money left and right, everything should just go through like a process or like a review process, and like do not waste money, right? We're dealing with that right now. We sort of allowed people to go free for all 2-3 years ago when we raised like the huge amount of money, and now we're sort of dealing with like how do we stop spending, wasting millions of dollars, right? So just be super disciplined. That's a whole other conversation though. Very early days, we would manually check in because we had just a few customers. We could do that. Later on, we built some automation with HubSpot. We would just be like a automated check-in, made it look like it was coming from a real person. And then customers would just respond to that. So engagement on those is actually also key. If you see a lot of customers responding back with like questions or like, this is actually where my next point was about power users. In your check-ins, if people are coming up with like lots of ideas and like really showing that they're power users of your product, that's a huge sign that you have product market fit, right? Especially for your early adopters. If you're getting like 10 of these types of power user cases a week, like where people are asking deep questions about your product and saying, hey, how can we improve this? Or how can we do this? And then they're sending you long emails, for example. That's a huge indicator that, you have product market fit. That you have engaged users, right? That people are actually using the product, right? If customers are not telling you, sending you long emails and like doing that kind of thing, that means you probably have a problem, right? That you're just a nice to have, you're not a must have. Yeah. 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 Early on, it was super cheap. It was like $200 a month. But pricing, I think, is something that you could sort of work on over time. You don't have to get it right from the beginning. Don't spend too much time. It's a whole science in itself, figuring out your pricing. In the beginning, just focus on getting people to pay, but also getting them to just use the product, and you don't have to be charging the full price early on, right? Because you're still going to be figuring out the details. You're still figuring out like the product, making it work, right? So I would say focus on getting people to buy. Pricing you can sort of figure out later on as you learn more, right? As you learn like where you drive value, basically. So this is more of like psychology. So my co-founder is actually he's a strong believer in this. Like, don't give away your product for free. And and I think he's right. Like I disagree with him early on. I was like, hey, why don't you give your product away for free? And the reasoning is because once you give something away for free, psychologically, like your mindset is, okay, this thing is free. I'm not committed to like using this thing, right? There's no commitment here. I'm not spending my money on this, so I'm actually not going to even care about it as much, right? So I think that's one thing. The second thing is, if you're solving a problem for someone, they should pay for it, like as a principle, right? If you're doing all this work, if you're framing, if your mindset is like, okay, I want to get paid for this, that's where you'll see results, right? If you're giving away your product for free to everyone, I just think it's a losing strategy. It's not going to work out. And I can talk more about that too, actually. I have some bullet points on that. But I'm just going to finish the section on how we found product market fit, or how we knew we found product market fit. So yeah, I think between 2018, 2019, we kept adding more features, adding more and more features. But we were still only like 7 people on the team. And at some point we hit about $1 million annual recurring revenue, or actually $2 million annual recurring revenue. And we kept sort of the same team, right? The same features, or the same mindset of like just building more features without thinking about, okay, now it's time to scale. Right. And that's a different mindset, right? Once you sort of hit that point where, okay, I hit product market fit, it's a change in mindset. You have to sort of accept that and say, okay, no more new features for now. Let's scale this thing up, right? Let's add some sales and marketing to this and scale this thing up. We realized that in 2019, late 2019, and 2020 is when we started hiring a bunch of people. So we scaled the team from 7 people to about 40 in a span of like 6 months. We raised our Series A in 2019, late 2019, about $4 million from the investor that actually pointed out to us that you guys are way past product market fit. And so I think I talked about some of the qualitative measures for that, quantitative measures for that. But I think once we sort of realized that, we hired a bunch of people, and from then it was like a much smoother ride on, like, doubling our growth, tripling our growth, et cetera, et cetera, et cetera. So we were profitable, which is also why we didn't want to raise money and become unprofitable. It was also like, we did all this work to become profitable. Let's actually keep it this way. Our metrics were amazing. So there's a trade-off to be made. There's pros and cons to raising and going that route of like scaling, which you have in product market fit. It'll just take longer. So actually me and Arshan go about this all the time. Like, should we raise money after product market fit or not? For other reasons, I think if you have a profitable business, maybe it's better to just slow it down and like, scale it slowly instead of trying to scale it the typical VC-backed way, right? But yeah, I think for most people here, I think, yeah, once you sort of find that product market fit, just know that you have to make a decision on, okay, we found it, now it's time to scale, right? Whether you raise money or not. So going back to what you were talking about. So actually, I'm actually going to deconstruct some of the companies here, if you guys don't mind. So I'm going to call out Arshan, I'm going to call out Yasin and Masood. So I'll start with Masood. So I had a sales call with Masood, I think 2 weeks ago. One thing I would give advice to you is, before pitching the product, try to find out what are the pain points that I'm dealing with in like the recruiting space. So like I came into the call with like a different mindset of like, I have this specific problem in my mind, and I thought your product did sort of some of that stuff. The product in my mind was, or the problem in my mind was, we get a lot of inbound, but also outbound. It's hard to know which profiles are the right type of candidate that we want in our recruiting pipeline. And I feel like there's a lot of misalignment with my recruiter on that, right? My technical recruiter. And so the problem I wanted to get solved was making sure that the right candidates end up in the pipeline, so that when the recruiter screen happens, there's a lot less noise that she has to deal with, right? Because right now she's having maybe 20, 30 calls a week and like 5% pass rate, right? So how do we improve that, right? That was the problem in my mind. But you sort of just went in and like started selling what you sell, right? I think your product's interesting. I think it's a nice to have. I think to make it a must have, you need to do more work. I think to make it, you're sort of going up to greenhouse and lever in these companies, right? That's sort of your competitors.
Different. These are companies that stay in the ATO space.
Yeah.
But our vision is to become the one-stop shop for finding new talent.
Yeah.
But coming back to your pain points, like 100% agree with you. And what's actually been interesting, your pain points is exactly what some of our agency customers go through. And since I've done the recruiting job, maybe my passion's not messing. But like, what's interesting is that I think the opportunity here is like also like bridging, reconfirming the problems, like you said, to kind of build that trust. As I mentioned.
Yes.
So, yeah, happy to connect with the recruiting.
Yeah. Yeah. So one thing I would say is try to dig into the problems that the person you're talking to, like what are the problems they have on their mind in the space, and then point out problems to them that, hey, this is a problem for you. I could increase this for you. And then also taking into account feedback that they have that could improve your product, right, as well. I think you're onto something. I think you have more to do on finding the product market fit and like making it a must-have, making it transformative for like someone like me or someone, maybe a recruiter, right? And I think one of the biggest ways to validate that is, so you gave your product away for free. You gave me a trial, and I haven't touched it since, right? I haven't even looked at it. If you got me to pay, forcing me to pay, and I think before this you also mentioned you have 150 customers, but most of them are not paying. To be honest, they're not really customers at that point, right? Maybe they're using the product, but if they're not paying for it, they're not a customer. They're just using your product, right? And maybe there's different strategies on how people get to growth, but I think what you want to get signal on early is this a must-have? Is this transformative? Or is this a nice-to-have, basically?
I think going back to like our data shows like 90% of those 150 use the product every day. But since we're in a new category and doing new behavior, it takes time.
Yeah.
But one of those agencies I gave the product away for free posted a job and actually netted me 6 paying customers.
Nice.
And
Awesome.
so that's the strategy. Even though you may think it's a losing strategy, I will actually push back and say, I'm more focused. The money will come. I'm not worried about that.
Yeah.
So getting this new behavior out there and unlocked for people to see is our way to leverage our customers as marketeers. And so that's kind of the thing about
Nice.
it.
Cool. For Yasin's company, HeadStarter, I remember when I first started talking to Yasin, I think 2 years ago. I think I asked him, like, what is the problem you're solving? And he was just like surprised at the question. He had no idea. I think it took him a while to like figure out what is the problem we're solving. There was a lot of back and forth over email after that. But I think you sort of started defining the problem a lot more concretely after that. I still think you have more work to do on product market fit. I think similar as Masood, I think you have to stop giving away your product for free. I think you're in a harder place. You're going directly to consumers. You're also selling to broke people. I don't know how you're going to do that. But basically, yeah, find a way to monetize as soon as possible to understand, like, is this something real, right? The more you give away for free, I think, yeah, time is not on your side, basically, right? And I think you have to sort of figure out, like, how am I transforming the people that I'm sort of training for jobs and things like this, right? Are they actually up leveling? How do we actually measure that, right? Is this actually transforming? Can they live without HeadStarter, right? Ask yourself that question, right? And do you think that that's the case today? I have to sync up with you. Maybe that's the case today. Maybe it's changed. But I think last time we talked, does HeadStarter like transform someone's life? Like without HeadStarter, they couldn't have done the same thing. Yeah. Go ahead. Mm-hmm. I mean, the different strategies, like free has a place, but it shouldn't replace. At the end, like your conversion should be at some point. The conversion should be happening at some point, right? If it's not happening, and like majority of your customers are on free and they're not converting over like 3 months, 6 months, etc., then you have a problem, right? So you have to get them to convert at some point, and you have to have a plan for that, and you have to see it work too, right? So like having a trial for them. Yeah, a trial could work as long as you have a plan to convert them, and it's working. Yeah.
You go ahead.
So
we've seen like a lot of iterations and ups and downs in our startup. We want to create an ecosystem, right, where we skip the HR route, also do the upskilling route. If we're able to get free customers and high retention, we think that kind of makes up for that. Like, you can have customers who are paid also low retention, but you can have customers who are free. They have a plan to convert them and high retention. I think that kind of makes up for it. Every business is different. I know.
Yeah. Yeah, I guess we can talk more about that. It's more like a nuanced question.
Yeah.
Yeah.
Like they use it every day. They spend like hours on it.
Yeah. Yeah, I guess there's other metrics too that you could look at, like daily usage, engagement, right? Yeah, yeah. Maybe that makes more sense for your industry, right? Because you're in a different industry where your users aren't necessarily like making a lot of money, and they don't have money in the first place, right? So maybe, but you have to sort of figure out like how will you make money at some point, right? Yeah. And then Arshan, for WorkSense, I think you did the best job from like a seed stage startup of like sort of the Muslim founders that I've seen recently, which is like you got on a call with me, you sort of understood like what are the problems that I deal with today, what are my processes today, and like you did the right investigation. So I think that was good. I think you're onto a big problem. I think you're gonna get there soon. I think the product itself needs more, like I mentioned to you, like daily usage, right? Like for me right now, it's like I check it once and it's like, okay, I already sort of knew this. What do I do next, right? Or how do you make me use a product at least weekly, if not daily, right? Or if not for me, for my HR people as well, right? And again, like the product, don't give it away for free. Make sure people pay for it. That's also key. It also force you to provide value quicker. If people are paying for it, and then they're going to complain about it, and then you're forced to sort of make those improvements faster, right? So, sort of similar advice, but I think you're ahead of the curve. Yeah. Yeah, I think that's all I really had. I'm sorry, I didn't really prep much for this. I don't really speak publicly often. This is my second time probably doing this. Go ahead. A little bit. So we ended up working on a platform that was HIPAA compliant. We have to be HIPAA compliant. So on the engineering side, we built on something called Aptable, which was healthcare. It's like an AWS, but HIPAA compliant. So that helped us a lot. But I think in terms of being fully HIPAA compliant, no company is actually fully HIPAA compliant, and everyone's sort of ongoing. It's always like improving over time, and there's like retraining that you have to do. It's like a lot of processes and knowledge training and things like that. But we didn't let it stop us. Basically, there was a point in the beginning where we were sort of HIPAA non-compliant, but it shouldn't stop you from like. I think security and compliance you should always save for later. Figure out product market fit first, then you can figure out compliance and security, right? It might slow down some deals, but if you're good at selling, if you're good at solving a customer problem, like you can get around those security concerns as well, right? And we did that like early on. We would have like a CIO get on the call with us and say, is this HIPAA compliant? Is this SOC 2 compliant? We're like, what is that? But we were able to get around that by just going back to the decision maker and saying, okay, is this solving a problem for you? Let's get past this. We'll become compliant. We wouldn't say that we're not compliant. We'd say we're working on it. That's what we would say, sort of. Yeah.
So this is like back to pricing and how you charge on a monthly basis. So we're kind of right now working with like a lot of our enterprise users who are like, we're trying to convert to customers. And one of the big things is like providing this like white glove service. They all want that, and like we spent like hours like talking to some of them, and we're like, what? Everybody has a different white glove service type that they want. How did you, in the early days when you were like, that 90-day everybody's using it, how did you customize each white glove experience to each customer? If you could talk more about your white glove experience.
Yeah, I mean, it's a white glove experience, so it was custom for every customer. Even till now, we still do white glove onboarding. We're still I'm actually going to take on a project to actually automate, but also standardize the entire process. It's still not standardized to this day. That's how white glove we had it since the very beginning, especially for enterprise customers. For the smaller customers, we've sort of had like a playbook, automated playbook. A lot of it's a lot better. But but it's still an ongoing process. We still white glove as much as possible today. And I think white gloving is where you sort of can ensure that product adoption is like 100%. You can also gather feedback actively during that process. You can also make sure that you're solving the right customer problems, right? We're sort of in a complex industry where you can't just like plug and play. Each customer's workflow is different. Their problems are different. Their needs are different. They function differently within the office. So it's, yeah, I think white glove is, we're going to have some form of white glove going forward. Like there's going to be some type of nuance to each onboarding. Yes, I'm doing one right now for a customer that has like hundreds of locations all over America. Maybe some of you guys have even been to one of their offices. So they use 6 different electronic health record softwares. So it's a very like complex setup. They're trying to consolidate all those integrations into for one product to be able to use for all 6 types of electronic health record integrations. And they're very meticulous, very detail oriented. They have like regional offices. They have Texas office, Florida office, East Coast office. They have call centers. So a lot of different moving parts in terms of like who uses the product. Each, there's different people using different parts of the product. Some people are using the scheduling tool. Some people are using the forms tool. It's all like different people. They have to train separately on the product. So we have a team of about like 7 people just on this one account, right? And I had to sort of step in because it wasn't going too well. And I was telling myself the other day, this feels like 2017, right? It feels like the early days. So I think as a startup, if you're solving a customer problem, you will have to have some sort of skin in the game even later on, like some type of white glove. This is more for like B2B. I think it's different for other like B2C startups. But I think for what you're doing, it sounds like it's similar. But yeah, does that answer your question? Yeah, okay. I saw, go ahead. The pull from the market is more than you can handle. That's like the simplest way. And we sort of felt that for a year and a half or 2 years straight before we realized, oh, this is actually part of market fit. We should stop what we're doing, right? We were handling 4 people or 6 people were handling 1,000 plus customers. And that's just, people were like, that's crazy. Looking back at it, we're like, yeah, that is crazy. But when you're in it, you actually don't realize that you're in that stage, right? It's actually, you have to zoom out and like tell yourself to like zoom out and say, are we at product market fit yet or not, right? Because your numbers are improving, but you're just like, oh, they could be better. They could even be better, right? And then qualitatively, the qualitative signals might come later on, like I mentioned, like knowing the power users, knowing how existential our product was to customers. We didn't realize that until like 6 months in, 9 months in, right? But I think like the earliest signal is like the pull from the market is more than you can handle. Like I was working 15-hour days. I think that was enough to like, right? So that's my definition. Yeah. So, sorry, repeat that. For the API product? Yeah, so the API product we released in late 2019 as like an alpha product. I sort of, there was a customer we were talking to that ended up getting bought out by this company called Quip. You guys have probably seen Quip in Walmart and Target. They do like toothbrushes and floss and things like that. So they have like 100,000 dentists on their platform. And they wanted to sort of monetize that relationship with the dentist. So they have like a B2C product, but they want to do more B2B as well. And that's where the API conversation came in. They wanted to be able to integrate with the electronic health record software to be able to put data in there and read data out of there based on the usage of their own products, like the Quip products, right? Like how often are patients using the Quip toothbrushes, for example? They have like digital toothbrushes, I think. So my co-founder was like, hey, can you so the good thing was we had an API already internally built. All I had to do was sort of expose it externally. I did it within like 2 hours. Till this day, that same thing that I built 5 years ago, like the 2 hours of work I did like 5 years ago is still being used by almost 3,000 locations today, right? So we launched that in 2019 unofficially. And so it was like an accidental thing. It was something that we wanted to do longer term, but it happened way earlier than we thought. And since that 2019 decision, we just started selling it, ad hoc, like without even actually planning for it. And even till this day, we only have like 4 people managing the API product, right? We have one salesperson, who's also like, we have like a GM who's like a salesperson, a CS person, and like a technical support person. They're doing like 4 jobs at once. We have a full-time support person, and we have like half an engineering team managing that product today, right? Like even I'm doing support on that today. So yeah. What's the what? Yeah. So the way it works is like a company like Quip, for example, or if you guys heard of Smile Direct Club, they're also using our API, or like Pam AI, for example. So the way it works is we charge per, I don't know if you pay per pricing or per location per call or per location per month. Yeah. So a company like Pam AI will pay us per month per doctor's office that they onboard through NexHealth, right? And I think you can make as many API calls as you want through that model. But the cool thing is, like, one thing we want to launch next year is a marketplace where the users of our patient experience product can actually buy products like Pam AI on our platform, right? Like an app store, basically. So that's actually like the bigger initiative that we have next year, where we could charge maybe charge 20%, 15% commission on like anything that we sell through our marketplace. So you can also charge your dentists or doctors through our platform for your service. And then we sort of take like a 10% cut, 15% cut, whatever that number is. So we can make money off of that as well. So in a way where you have a distribution engine, right? You can sort of go to market on our platform. You're sort of new. You have to spend less on sales and marketing. So that's like one of the things that the API product sort of enables. We're going to have a marketplace for it sometime soon. Sure.
Like, where is can you tell us how much it costs for each third-party doctor that is connected to your systems, and how did you think of that? Because I guess you could price it $5 a month for each doctor. You could also potentially go at 30 or 50. How I know different unified APIs have different approaches to pricing.
Yeah. So the question is, how do we price the API product? We're still trying to figure that out. Yeah. Pricing is like is really hard to like understand, like what is the value you're providing and how much you can charge. I think we just sort of chose like a good number to get people to start onboarding, but also pay us. But there's a lot more that we could do there. I think we're still trying to figure out. But in a nutshell, it's going to be, we're sort of following the approach of like value-based pricing, like charge for the value that you provide instead of like flat pricing. Flat pricing is easy because it's simple to understand, but I think value-based is better for both the developer building on the API, but also better for us as well. Yeah.
I have 2 questions. So my first question is, they say 10% of all code that's written today in the world of code is human-facing, right? Like UI, UX, kind of like your ideal customers, right? And then 90% of all code that's written is like back-end, so like API requests, interfaces. I believe that 5 to 10 years from now, like 50 to 75% of all code that's going to be written is going to be agents or agentic interfaces. If you're using Amazon.com, an agent's going to go make the order for you, and every company is going to have like a parking lot to accept agents and then give them what it needs for the job to be done. Do you agree with that? Do you see, like, as a CTO, as an API vendor, do you see it?
Yeah. So you're saying that AI will generate a lot of the code and the... Yeah.
The agents would probably still have to be created by humans, like really good software engineers, but like it'll be like more, like less specific, right? Like less specific UI, less human UX, less specific like API like docs.
Yeah. I think that's correct, 100%.
Kind of like follow up to that. Like my hope is like we become the #1 place where the caliber of folks that create those agents, like they come from like Headstarter, like because they know everything. They're like top talent.
Yeah.
That's my pitch.
That makes sense.
Do you think that's like I can raise money with that?
You got to raise money with the metrics, right? The vision is you can sell the vision. You have to back it up with like the metrics.
Okay.
Yeah.
The last question is like basically, like I look up to you a lot, right? And like I think we all do. Do you really think like we can raise money from Muslims for our rounds? And if we did raise money from Muslims, like do you think there'd be high value add? Because I feel like a lot of family offices or high net worth Muslim individuals, like they're not familiar with this space, and they made their money likely from not software, from like something else, right? Like,
Yeah.
So what are your thoughts on? Also, you said you had like investor that gave you like tips, like oh, you already found product market there, right?
Yeah. Yeah, I think when it comes to this space, I think Muslims are behind. It can be done. Like you can raise some Muslims, you can get it done. But if you're trying to match what you see like these other companies doing, it's probably not gonna be the same level. And I think that's fine. I think that's by design. Allah actually made it that way. Because to get to that stage where like you're actually me and I are trying to have this debate all the time, like whether you should stick to Muslim investors or not. I think it sort of depends. You just have to find someone that's super aligned with your vision longer term and like won't get in your way when you try to keep things halal and when you try to do things the way they want it to do, which is going to be very hard. It's very hard to find someone like that, especially if they're not Muslim. Yeah, I think it's still like an open question in my mind. I'm still trying to figure it out myself, actually. But I do think we should try to stay within the Muslim community and build that muscle ourselves and start now, basically, right? Obviously, it's going to be hard to do that, and I think you shouldn't block yourself if you have an opportunity. And then you can learn the hard way, like the way I did, about like what happens when you have like non-Muslim investors who aren't like values aligned, right? A lot of VCs have like just bad worldviews, I would say, right? If you're comparing it like to like a Muslim worldview. But yeah, I think if you take their money, it's fine. Just know that you're gonna have to deal with consequences later, right? And then just deal with it the right way later.
So in a practical way, how could I like, let's say I anticipate someone's gonna give me a term sheet in like 2 weeks, and I know they're not gonna be aligned, right? In terms of values, like they might be great for business, but it's a harbinger for something to come later.
Yeah.
Is there anything I can do now to kind of set up an alternative path with someone who might be more aligned, or like, is there any advice you have on that?
Yeah, again, like this is more of a place I still don't know the answer. I'm still trying to figure it out myself. And I think foundationally, in terms of the principle, I think try as much as you can to avoid that. If you know, for example, like this investor is going to make me do business that's in a haram industry, for example, like alcohol or something, right? Just stay away from that from the get-go. And I think you can't really tell from the beginning. It's just hard to know that, right? From non-Muslim investors. I think my answer to that is just stick to your own principles longer term, short term and longer term, right? At longer term, you might have a fallout with some of these investors and you can maybe deal with it then. And that's like experience for you, life experience for you. Maybe you get kicked out of your company because of this too, right? Longer term. Or maybe you don't. I don't know. But just stick to your principles no matter what it is. Yep.
We have time for one last question.
Sure.
Yeah.
So, what do you think, like the Alif team and us, like being part of this cohort, like, I think some of us came here with the objective to like raise money after this. Like, what do you think we can do to like rally Silicon Valley or other places so that we can keep money within the community and also get like that smart, like, advice?
Yeah.
Like in the next like 3-4 weeks.
Yeah. I mean, this is like the first step. I feel like this is the first step in that direction. So, maybe 3, 4, 5 years from now, it'll be a different story. But you're like the seeds for that. So you're gonna have to struggle more. That's just the way it works. Like the early people, the people that the awwaleen that we call, right? They have a harder time doing things, right? That's just like the way the system Allah set up. So you're just gonna have a harder job. I think that, but you're setting the seeds, and people will look up to you 5 years from now that, oh, these guys did it right. These guys did it the right way, right? Yeah, it's gonna be hard. I think, like I'm still getting a lot of acquaintances recently of like Muslim investors or Muslims that have made it. I've been here in the Bay Area for 5 years, but I haven't met people like this up until like in the last 12 months or 18 months, I would say. And every day I'm meeting someone new. Every day I'm meeting someone. Oh, this guy's super interesting. They made a lot of money back then, right? They've built something. I think we just need to sort of keep that going, keep getting to know each other, and then within 2 years, like we'll have a much better ecosystem for this, inshallah.
Come out here.